Good morning, this is Bill Blatchford, another episode of Mornings with Bill. I've been asked to talk about the way we speak with patients. And the way we speak with patients, of course, is letting the patient drive the conversation. Well, what do we mean by that? Well, I learned that from listening to an interview, actually at a sales course that I attended. And by the way, when I ask about sales courses and dental meetings I just recently spoke at Chicago Midwinter Meeting, several hundred doctors, and I asked how many have ever taken a sales course, put your hand up, and we get a handful of hands. And I usually ask them, what did they used to sell? Well, they took sales courses when they sold something else, but now they're dentists and they don't have to sell. Well, we point out that that's correct. The American public is spending more on bottled water than they spend on dentistry, so it's obviously we don't sell. But if you were to start thinking about a sales conversation, the interview with this boat salesman said, I never have a boat in mind when I sit down with the prospect. In other words, he lets the prospect, he lets the person that wants to buy the boat tell him what kind of a boat he wants. Now, it's the same thing in dentistry. You see, you have to sit down. If you're going to allow the patient to drive the conversation, when you're sitting there with the patient, you have to sit down without an agenda. In other words, you have to get this agenda of a dentistry that you think they need based on your value system. You have to get that out of your head. Clean slate, sit down with the patient, and simply start to ask questions about what they want. You see, if you start asking questions to a patient, and this takes some practice, it's not something that comes easily. It's something when we're so used to telling patients what they need to shift to let the patient drive the conversation. And by the way, I've been teaching this for many years, and dentists are constantly coming to me absolutely amazed what happens when you allow the patients to tell you what they want instead of you telling them what they need. The other advantage is, when they accept the treatment that was their idea instead of your idea, there are a lot less complaints. You might think about that. This was their idea. And you see, it's the same thing. It also takes a large weight off your shoulders, because if they reject the treatment or say, no, not now, it's not like this big weight on my shoulders that I've been rejected. They're simply saying no to what they said they wanted themselves. So you start asking the questions, and they will drive the conversation. Now, my suggestion is you start with long-term goals. If you start asking the patient what they would like for their dental health, have you ever thought what you would like for yourself, say 10, 15, 20, 30 years from now? And when you put patients out into the future, they always want the same thing. They want their teeth. Now, the question I like to find out is, do they want their teeth in a jar on the nightstand at night, or do they want them in their mouth? I mean, play with them a little bit. You'll be amazed. And they, of course, will all say that I want them in my mouth. Real simple. Doctor, can you work out a treatment plan to help your patients keep their teeth the rest of their life? Of course you can. Now they've asked you to do that. Now, since they're going to have their teeth the rest of their life, generally they want to have freedom from problems. They don't want broken teeth. They don't want dental toothaches. They don't want any of these dental problems. Can you work out a treatment plan to give them that? Of course, but they've asked you for that. The other thing we find is when we ask the questions, we also find that patients say, I want my teeth to look as nice as possible. I'd like to have a nice smile. Doctor, can you work up a treatment plan to provide me with a nice looking smile? Again, of course. But you see, now the patient is asking you for that. They're driving this conversation. And if you follow the rest of our power questions, thinking about long-term goals, tell me more about that. Never make an assumption that you know what they're talking about. Always ask the patient for clarification. You know, Brian Tracy, one of the really great sales trainers, he says the most powerful question that anyone can ask is, tell me, exactly what do you mean? And if you will keep that question in mind and let the patient tell you and let them drive the conversation, they will tell you pretty much why they want the treatment plan that you probably would have prescribed anyway. But now it's their plan instead of yours. Let the patient drive the conversation. If you would like to tweet us with comments or questions about this, tweet us at Dr. Blatchford.